and welcome back to my YouTube channel. Today our topic of the day is hair. Why did I choose hair? Because it's a pivotal role in our life. It helps in determining how we look. But what happens when this hair gives us a negative self-confidence, negative self-esteem? It really affects our day or entire life. What do we do about it? Today, our topic about a problem, how we're going to solve that problem. So for that, we have a well-renowned dermatologist and esthetician on board with us, who's been associated with us for quite some time. Did you know that hair transplant costs around 16 to 25,000 US dollars in America or any other part of the world, while the same procedure can be done in India for 1/10 of the cost? Today, we are with Dr. Shankila Mittall, a board-certified dermatologist from one of the best institutes all over the world, and especially in India, of course. So, thank you so much, Dr. Shankila Mittall, for coming on my channel.
Hello, thank you so much for inviting me here.
Great. So I'm very happy let's cut it short and let's talk about hair transplant. Why would you suggest a patient coming to India? Why would a patient come to India for hair transplant?
See, because in India we offer the best hair transplant services at a very affordable cost. We have the best OTs here with good sterility, a good technical team with well-trained doctors who are able to provide the best services at an affordable cost. So I don't see any reason to not get it done from India.
Okay, so what would the costing be as compared to any other part of the world?
So costing in India is much lower. It's about I'll say 30 cents a graft or maybe 30 rupees a graft, and which comes down to the overall cost comes down to be around $3,000, which includes your pre-workup, your procedure, and the follow-up medications which you need to do just after the procedure. So overall, it's very reasonable, very affordable, yet there is no compromise on the quality, and we're offering the best service possible.
Oh wow, so that's very cheap, right? As again I said, India, it's supposed to be a very cost-effective country, especially for healthcare. So what about, how long do the patients have to stay here for? A patient who wants to come all the way from United States, United Kingdom, or even Germany, how long does he have to stay here for?
See, if somebody is planning to go for hair transplant, we first prefer connecting online with the patient for a pre-consultation, which is done mostly 1 week or 2 weeks prior to the procedure, where we can exactly see how many grafts are needed, whether it's an ideal candidate for the procedure or not. Then whenever the surgery is planned, we expect you to fly 2 days earlier so that we can do a pre-workup, all your pre-investigations can be done to ensure safety of the procedure. After that, the procedure takes 1 day, and if the number of grafts is more, it can take up to 2 days. Post-procedure, we put a light bandage. You can fly back with the bandage, but what we prefer is that you stay in India for about 2 days so that we can remove the bandage, give you the first head wash, teach you how to wash your head 2 weeks later on, till 2 weeks, and then you can fly back. So basically, you need to be here for about a week, and if you're in a hurry, then at least 3 days.
Okay, so after pre-consultation, I can probably see Delhi. Once I meet you, see Delhi, right? Okay, and then go in for the surgery, the grafting. So is there a daycare procedure, or do I have to be admitted?
You don't need to be admitted. We normally ask you to come in our office in the morning. We complete the procedure by the evening, and you're good to go in the evening.
Okay. So will it be under local anesthesia, general anesthesia?
It's done under local anesthesia. We particularly give some nerve blocks as well as rim blocks so that you don't feel the pain. And after the anesthesia, it's mostly a painless procedure.
Okay. And what about medication? Do we start medication right away? Does it pain us? Can you tell me a little bit more about it?
So see, I'll tell you how the procedure is done basically. First of all, when we meet you first, we discuss what are your expectations and what we can offer. We assess your donor area and we see how many grafts can be extracted from the donor area. Donor area typically is the occipital area, that is the back of your head, and in some cases when they have a good beard, donor area can be the beard also. Some rare cases we do take donor area from the body and axillary hair also, depending on how many grafts need to be done. After assessing your donor area, we plan a hairline for you. We decide how ideal your hairline should look, and from the donor area the hair are extracted and then implanted into your hairline. The best part is that we make sure that the out of body time for the grafts is minimum. So we are basically taking them out and putting them all together. So within an hour, like one graft it's out of the body, within an hour it is implanted into your head, which makes sure that the graft survival is better, because of which the graft will stay and the graft will be taken up well by your body. After the transplant, we just put a light bandage. You have to spray a liquid which we will be providing to you on the transplanted area to ensure that the grafts are hydrated, and again we make sure that the survival is good. In fact, during the surgery, all throughout, we have a team which keeps on spraying a hydrating solution on the grafts, again to ensure that the survival is best. So we take all the precautions to make sure that you have the best graft survival, and as many hairs which are transplanted are taken up by your body. Post that, you're good to go. You can be at your home, you can be at the accommodation provided, you can travel around, there's no problem with that. You can just wear a bandana if you want to hide the transplanted hair, or a light cap is also fine. And second day, we just remove the dressing, we give you a head wash, we teach you how you can do head wash on your own when you fly back. It's very simple, you just need to dab a shampoo and just wash it off with water, and there's not much post-care needed after that.
Okay.
The grafts which are implanted, the major precaution which is needed is for the first 2 days, and after 2 weeks they're like your hair. You can trim them, you can shave them, you can cut them, they will just grow back like they're growing.
Okay, that's very cost effective, at the same time quality care. That's what I talk about. Quality care is provided at a very cost affordable price. So, okay, and what about medication? You know, I mean, sometimes, you know, patients, the same medication which is provided here is not provided all the way back in your home country. So what do we do about that?
See, post-surgery, the medications which are needed for 1 week, we provide it definitely right away, so the patient don't have any trouble. And in fact, we advise patients that some medications which will be needed to be applied on the area, they should carry a stock for around 3 to 6 months. Other than that, there is no such medicine needed which you won't get there. Most of the solutions which we need are OTC products, and you will be able to get them there also.
So your package is inclusive of all the medication, your lab costs, all of that, right?
Yeah, it is.
Okay, great. So as I said to you before, it is a 1 week long process, as she said, depending on what your graft is needed. What about, do patients need to come for follow up after the grafting is done? How do you go about with that?
See, once the grafting is done, they're your hair. They're going to grow, you can groom them, you can do whatever you want. So you really don't need to come to us again and again. Once you've transplanted the hair, at 2 weeks you see them as very short hair. After 3 months you see them growing properly. And between 6 to 9 months you see a decent full growth, and at 1 year you see the expected full response. We just expect you to follow up with us, like once in 3 months you can send us a picture so that we can assess that the hair are growing well, which they will, and not much follow-up is needed.
Okay, so that's good, right? And once your procedure is done, you're good to go. And whenever you want to talk, just connect with them on video consultation.
Yeah, that's not a problem.
So have you had any patients who had come to you internationally from international places to visit you?
Yeah, that's a very routine actually. We keep on having international patients with us for one or the other procedure. Not only for hair transplant, in fact, we have international patients visiting us for many surgeries like blepharoplasty, in which you have droopy eyelids, or under eye bags, for facelift procedures where there's a lot of sagging of face or neck lift is needed, for fillers, for giving support to the face, as well as for Botox, for relaxing your fine lines, as well as a lot of patients pouring in for mommy makeovers. After having a baby, you get saggy breast, you have a flappy tummy with a lot of stretch marks, and nobody likes that. So you can go for a total mommy makeover and get rid of all those things also. So we have international patients coming in all the time for all these procedures, and they're very happy with the results. In fact, recently we had an international patient, like last week only, who came on Monday, got pre-workup done. He went to Agra to see Taj Mahal. He was having fun just before the surgery. Then he came in, we did the procedure. He was happy. It was like it was a 1 day surgery. 2 days later, we removed the dressing and he flew back. So in 5 days, he was out of India again.
Again, medical tourism, as I said, you can travel at the same time, get your medical health done. Great, thank you so much. I think I need to come to her for mommy help. Right. All right. So yeah, thank you so much. She's been associated with us for quite some time, and we have recommended a lot of patients to her, and she's been taking good care of her patients. Right. Thank you so much.
My pleasure.
Great. Thank you. And please connect with us in the next video.